Hello everyone, welcome to the class on beta blockers that are used in congestive heart failure. Beta blockers I have already explained in my previous videos in angina pectoris series. In this video I am going to explain beta blockers that are exclusively used to treat congestive heart failure. For remaining things, please refer to that angina pectoris beta blockers video. Now, in this series of congestive heart failure, the first video I have explained about cardiac physiology. And then I have explained about congestive heart failure pathophysiology. Then I have explained congestive heart failure pharmacotherapy, which also includes inotropic agents. I have devoted a complete video to explain about renin, angiotensin, aldosterone system, and then one more video for diuretics. Now in this video I will explain about beta blockers and then some other drugs which are used to treat congestive heart failure. Let us begin. Now before going to beta blockers, we need to understand what happens with beta 1 receptor stimulation. Beta 1 adrenergic receptor are exclusively present on heart as well as renal tissue. Now the effects are, they increase frequency of heart contraction, that is nothing but increasing heart rate. This is known as chronotropy effect. The SA node contains beta receptors. By activating that, it increases heart rate. The beta receptor molecular mechanism of action is, when they are stimulated, they increase calcium levels in the cardiac cells. The increased calcium levels will cause all these effects. The first one is increase in heart rate. Second one, they also increase automatism, which is known as bathmotropy effect. In AV node, beta receptors are present. They increases automatism. Automatism means, see, in human body, most of the cells will respond to nervous stimulation, whereas cardiac cells do not require nervous stimulation, they have automaticity. And this is because of AV node beta 1 receptor activation. After that, beta 1 receptor stimulation also causes increase in contractility known as inotropic effect. The next one, the stimulation increases conduction speed, that is known as dromotropy. And all these effects will increase oxygen consumption. Now finally on kidney, they increase the secretion of renin, which will start renin, angiotensin, aldosterone system activation. So this is what is the overall effects of stimulation of beta 1 receptors. Next, why beta blockers are used in congestive heart failure? Let us understand this concept. The congestive heart failure, the main symptoms are cardiac output is reduced. Why cardiac output is reduced? Because heart has failed, it has lost its ability to pump the blood efficiently. Now this finally results in cardiac remodeling. Cardiac remodeling means there is a change in size, shape and structure, function of heart. Now what happens when cardiac output is reduced? To compensate the reduced cardiac output, sympathetic nervous system is activated. Now this, when it goes for a long time, it is known as chronic sympathomimetic stimulation. This chronic sympathomimetic stimulation finally increases heart rate as well as increases cardiac contraction. But both the factors, increase in heart rate and increase in cardiac contraction, increases oxygen demand. When oxygen demand is increased, it may result in ischemic injury to heart. Ischemic injury may also lead to myocardial infarction, and this myocardial infarction may lead to fibrosis. Fibrosis finally cause arrhythmia as well as they cause cardiac remodeling. You can see what has happened. To compensate cardiac output, sympathetic nervous system is activated. But chronic or long-term sympathomimetic activation is finally causing cardiac remodeling, which worsens cardiac heart failure. Now, at the beginning, when cardiac output is low, inotropic agents are used. Inotropic agent, the basic job is to increase cardiac contraction. During the long term, because of continuous activation of sympathomimetic stimulation, when cardiac remodeling is happening, then beta blockers need to be used. Why? Because when beta blockers are used, oxygen consumption reduces, ischemia decreases, myocardial infarction decreases, and finally cardiac remodeling also decreases. So this is the situation wherein beta blockers are used. Remember this, in the conditions like acute decompensated heart failure. Decompensate means when cardiac output is very low. Compensate means cardiac output is compensated. Decompensate means cardiac output is very low. In that conditions, beta blockers are contraindicatory. We cannot use it. Only beta blockers are used in chronic congestive heart failure conditions. Next, What is the effect of these beta blockers? When beta blockers are used, we have seen what happens with stimulation. All these effects will get reduced with beta blockers. That means negative chronotropy, negative bathmotropy, negative enotropy, negative dromotropy, oxygen consumption reduces and renin secretion also decreases. This is what happens with beta blockers. Heart rate is decreased, contraction of heart is decreased, conduction is reduced, automaticity is reduced, renin is also reduced. Now, heart rate contraction tremendously reduces. When heart rate and contraction is reduced, oxygen demand is reduced. Next, conduction automaticity may result in arrhythmia. When both are reduced, arrhythmia is reduced. When arrhythmia is reduced, cardiac remodeling reduces. Reduction in renin release also reduces aldosterone, which reduces edema. So all of them are effects of beta blockers. This is what is depicted here. Oxygen demand is reduced, contractile function of heart is increased, perfusion is increased. So these are all the advantage effects of beta blockers which are used to treat congestive heart failure. Coming to the drugs, you have Metoprolol, Carvedilol, Bisoprolol and Nebivolol. These are used to treat congestive heart failure. The major adverse effects are heart rate is reduced because all of them are reducing beta stimulation, so heart rate is reduced and AV block may be seen. Conduction velocity is blocked, which may result in atrioventricular block. Now, beta receptor, some of them contains beta 2 blockade also. The beta 2 blockade may cause bronchoconstriction. Now, vasoconstriction occurs because when beta receptors are blocked, alpha receptors are active. When released norepinephrine is acting on alpha receptors, it causes vasoconstriction. So these are all the major adverse effects. Now, the other drugs which are used to treat congestive heart failure are, there is a combination is known as ARNI, ARNI, angiotensin receptor inhibitor and neprilysin inhibitor. Angiotensin receptor inhibitor is Valsartan, neprilysin inhibitor is Sacubitril. Neprilysin causes the metabolism of A-type natriuretic peptide, B-type natriuretic peptide and C-type natriuretic peptide. All of them, they are natriuretic peptide. That means they cause natriuresis. Natrium means sodium. Sodium excretion is known as natriuresis. When natrium goes out of the body, it causes a kind of diuresis, reduces congestion. So this combination, Valsartan is a vasodilator. Because it is blocking angiotensin receptor, Valsartan dilates atria as well as veins. That means you will be reducing preload as well as afterload. Both of them will get reduced because of this drug. Whereas Sacubitril will causes natriuresis as well as diuresis. So this combination is treating all the symptoms of congestive heart failure. So this combination is nowadays used to treat congestive heart failure. Now the other drugs, nesiritide is a recombinant peptide of B-type natriuretic peptide. So this increases natriuresis. The other drug, Ivabradine. Ivabradine is a sodium channel inhibitor, and this Ivabradine especially inhibits sodium channels that are present at pacemaker cells, that is nothing but SA node. So SA node sodium channels are blocked. Because of that, the action potential generation is reduced and heart rate is reduced. When heart rate is reduced, oxygen consumption is reduced. This is how Ivabradine is used. Thank you for watching this video.